Hey everyone, welcome to the Grow IT podcast. And today I have the pleasure of having RJ Kedziora from Astenda. And if you are involved in medical device manufacturing and have data, which is probably 100% of you, you're going to want to listen to this discussion today. So, RJ, thanks for coming.
Yeah, thanks for having me. Looking forward to the conversation.
Yeah, likewise. So am I. So tell me a little bit about your background first and your entrepreneurial journey. It's interesting, right? You've got a number of titles on your LinkedIn profile, but even in your current positions. So that's very indicative of the entrepreneurial journey. So maybe if you can kind of give us a little bit about your background and how you got to where you are.
Yeah, absolutely. And I guess it depends on the day of the week. What am I doing and where the focus is, truly being part of a small organization and very much working on the innovation and entrepreneurial side of digital health. I actually got my start early on. I was fortunate in seventh grade, way back in the 80s. My parents bought me a computer, a personal computer. And I definitely played my fair share of games over the years. But really was intrigued by the power of programming and what you can actually make that computer do. So I actually developed some of my own, early games and different things and played with.
What computer was it, by the way?
An IBM PC Junior.
Okay.
So
that's a big question I always ask, folks. It's amazing the answers from everything the Commodore to Apple and so.
Yeah, it had an infrared keyboard and a 20-point font, so you could sit across the room and still see the monitor. I don't know what they were thinking, but 20 characters on a line, it doesn't give you a whole lot of opportunity to do anything.
Right.
But it did lead me down my current path. I went to college for computer science and interestingly had a goal of going and getting a PhD in artificial intelligence, and then got a job offer and sort of made that decision of a lot more debt, the PhD route, or going more commercial route. And I did go what I think of as the commercial route. Got started working for US Steel in Pittsburgh and developed railroad car scheduling systems, which was one of those crazy things. I had to get the railroad car in the right place, and it was interesting. But then as my journey continued beyond that, and I worked for some big companies, some small companies, small consulting, big consulting company. Towards the 2000, worked for a company called First Consulting Group, which has now been bought up by various agencies, but we focused on the pharmaceutical area. Here in the Philadelphia area, a lot of the pharmaceutical companies have their corporate headquarters. So worked for a lot of those organizations. And that's really what got me into the area of healthcare. As we were working for those pharmaceutical companies, there was a lot of document management types of systems and data analysis as you were doing clinical trials. I was like, okay, how can I make a difference? And that's what led myself and my business partner, Drew Lewis, into starting Astenda. We could make a difference. I've done the accounting systems, the inventory management systems, and they're all very important. They're beneficial. They have there's a need for them. But with healthcare, there's that sense of giving back. And now it's very much healthcare medical software that we deal with day to day.
Yeah. So tell me about what your core offering is, right, at Astenda. Because obviously there's a lot that's under the, healthcare umbrella. There's clearly tons of data that gets generated, in a multitude of different ways. So maybe, walk us through what you consider to be your core offering.
Mm-hmm. Absolutely. I put it in two broad categories. The first of custom product development. So we typically will work with large organizations, in the R&D department, sometimes even the marketing groups, where they have an idea and we help them develop that idea into a full-fledged product that will then help take to market and support and implement. And it usually revolves around working with medical device manufacturers. So blood glucose, blood pressure, sleep data nowadays. There's a lot of data collected from that perspective, physical activity. So how do you make use of that data And that leads to our second offering, which is really around the data analysis and everything associated with that, creating your data warehouse today, a data lake, data mesh, creating that infrastructure and exploring that information. So from a product perspective, we can help you through inception to implementation, and then from that data analysis perspective. And that data analysis ties into even running clinical trials. We have a couple PhDs on staff. So it's one thing for us or other PhDs to say, doctors that we work with, to say, yeah, this works. But then you have to actually run a clinical trial. And we start with those pilot studies and then move into bigger clinical trials. We've been part of some R01 NIH studies, and NIH is National Institutes of Health. And then R01 is a 5-year clinical trial to really prove out that the product and algorithms, the intervention that you've created works effectively.
Is that pretty unique, that in terms of you can help a company with, from the go-to-market standpoint, everything from the product development to taking it to market, as well as helping on the consulting side from data standpoint? Because it usually you see one or the other, companies or firms that focus on one or the other, but not bringing in both. At least I haven't seen that.
Mm-hmm. Yeah, I think it is fairly unique. And one of the things we do from a training perspective with our software developers, the QA, everybody that's part of that product development effort, is provide that healthcare medical background. So if we're working in blood glucose or blood pressure or cancer, kidney disease, those developers, we're going to train them. There's just so much information available out there on the internet from well-trusted, vetted sources. We can provide that education. They're not going to be doctors. They're not treating patients, but having that much broader perspective of the patient's journey, understanding what that condition is about and having it, but also the physicians and the nurses, the care managers, how are they interacting with that patient? It comes down to empathy. If you really understand who your users are, the better off we're going to be.
Yeah. So what are the types of, when you come into a conversation with a prospect or maybe even a client, what are they trying to accomplish? What is their, where are they, when you get involved, what challenges are they having? Where are they trying to go? Like, what is it that would, you guys would come into the fold and help out? Maybe kind of give us a couple of different examples, obviously,
Mm-hmm.
to, have the device manufacturers and maybe even just independent have the, data consulting, but maybe if you can just kind of talk us through some of the different, pain points or what they're encountering on their side when you guys get involved.
Mm-hmm. I think of it in two ways. One, larger organizations. They generally have a lack of qualified resources. So we can come in with qualified resources and help them understand healthcare medical software development. What does it actually mean? How do we derive value out of this data? It's one thing to have the data. It's another thing to actually make use of it in an efficient fashion. As more and more devices are developed and the ability to capture more information, it gets harder and harder to analyze that data. So we've got 20 years of experience now dealing with these projects with a variety of customers across disease conditions in the large enterprise. And then we also work with some more startup organizations, and it's typically, your B, C round of investment. It's not the two people that started the company in the garage or their dorm room. They can't afford consulting fees. So it's, you have some traction, how do you go the next step? So we can help those organizations with a lot of those same challenges. How do we, they might have one customer, two customers. And when you get into interoperability in the healthcare field, unfortunately, the problem has not been solved. There are lots of challenges in healthcare interoperability these days, but particularly in the medical profession and healthcare, as if you go to your doctor, you have 10, 15 minutes with your physician, the nurse practitioner, if you're lucky, and it's 10 things. So if 10 different patients are coming in with 10 different devices with different types of data and different applications, how do they deal with it? So as you develop those new products, we need to bring it into the medical record and part of that workflow to make it much more usable. So we can help those large and small companies on that journey.
Yeah, it's got to be a challenge. I see that it's just like anything, right? The more technology advances, right, the more data it creates. And as you just described, right, you go into, whether it's urgent care, go to see a doctor, and if you're lucky, like you said, and you're going to have, different devices that are collecting data from you as a patient, both from the front end and the, in the actual office itself.
Mm-hmm.
Does that create? You talk about, maybe talk about the interoperability. Maybe talk about that. I'm because I see that, but the process is obviously unique in healthcare, right? Talk about the interoperability challenges.
Yeah, think of so first to sort of give it some perspective. Think of banking. You have an ATM card. You can go anywhere in the world and get your money. You can use Venmo, PayPal, and money is going to flow all around. Very much a solved problem. In healthcare, the data, admittedly, is a lot more complicated. And it started out with HL7 messaging, single point in time messages and containing data kind of thing. And so when you had software developers, analysts working with that, you really had to understand all the differences and the nuances of HL7 and the data. So there's multiple challenges. Today, there are what are called the FHIR protocols, FHIR, and it's API driven, and it's changing the industry. So there are still challenges of data, but now how to move that data around is much better understood. And there are more people that understand how to develop with APIs, which FHIR is API driven. So that has helped the industry significantly. Also the move, in the 2008, 2009 timeframe, the move to industry having medical record systems. And now, there's information blocking rules and requirements that the healthcare systems need to share this data. That's really changing. You as a person that goes to a healthcare provider have the right to ask for that data in a legible, like a computer readable format, such that you can do something with it, and they have to be able to produce that. The challenge today is really around what data is being shared and what format it's being shared in. And how is that captured? So I might do an LDL lab in one place, and another lab might run it a little differently, which causes those numbers to be, not, what is that normal range for this lab? Well, it can be different across those labs, or medication names could be different across systems, particularly if you travel between Europe and US, the medications have different names. So knowing and understanding that these things are the same, but then also keeping that information up to date. I just had an incident where I was, me personally, I'm going off to get new health insurance or life insurance. And they came back and they're like, oh, you went to this particular provider. And I'm like, I did? My daughter went to that provider, not me. But when they submitted that billing information, it's now has my name on it. And I'm like, well, wait, I didn't go to that provider. So now I'm stuck in this snafu with the life insurance company. Like, you need to go to the provider and get them to write a letter to say you didn't see them. I'm like, well, now my medical records are messed up because it has the information from that encounter. It doesn't matter that I'm male and my daughter's female. And so it's like, now you look at this information and it's like, oh, this is interesting. And there's those types of things still very much exist today. There was even a story just before Christmas of some data analysis of understanding when a person dies. And that information doesn't get rolled into the medical record system very frequently. So it's like you're analyzing data on people that really aren't there anymore. So what is the impact of that? So lots of data challenges still to overcome in the healthcare arena.
It had to have been funny, right? Of you being in the actual in the business, in the weeds of that business, and having example come up. Part of you was probably frustrated, and part of you was saying, "I can't wait to use this as an example," right?
Yeah, it is because, and my father and I have the same name, and so it's like bounce back and forth. And it's gotten better, but over the years, our data has been mixed up in various systems. We go to the same hospital for various things over the years, kind of thing. We're all in very good health, doing well, but that didn't happen to me. And then you got to go, and how do you unwind that information? So yeah,
that is the challenge, right? I mean, again, and I again ask a broader question: do you see it getting better? One of the questions I'll ask you later is related to trends and obviously in AI, and this kind of touches upon it. Do you see it getting better?
Yeah, it is. It is getting better. Yes. Okay. Or is it going to be solved next year? No. One of the interesting things that you see in many industries, and because I work in healthcare medical fields, there's sort of this idea of, oh, we need to solve this challenge. Oh, wait a minute, this group 2 years ago was starting. So there's various mechanisms that have come along in the years that are trying to solve this interoperability challenge. And so then, which network are you part of? Years ago it was regional health informational organizations, and then there's one called Commonwealth. TECFA is the newest one, which has a lot of promise, just came on board. But Epic, which is the biggest EMR in terms of market space here in the U.S., they've signed on as a qualified vendor in that network, so they'll be able to share information, which will be really nice.
Well, let's talk about some success stories. People love to hear those, and I always preface it by saying that success isn't always standing at the top of the mountain with your hands raised, saying we did it. It can sometimes be just getting through some set of challenges. Again, you've talked about having folks or having clients on the enterprise side, as well as having some of the startup type of clients. Maybe kind of give us a couple of success stories, maybe specific to each of those.
Yeah. One of the biggest success stories is a project we've been working on since our inception. Is 20 years now, and still very much part of it. Within the Indian Health Services here in the U.S., which is responsible for the healthcare of the American Indian and Alaska Native population. That population, unfortunately, is really hit by diabetes and other chronic conditions. With the Joslin Diabetes Center, which is in Boston, developed a camera system called the Joslin Vision Network. And it's deployed to about 100 sites throughout the United States right now for surveillance of diabetic retinopathy in the Indian health population. And diabetic retinopathy is one of the leading causes of preventable blindness. So if we find it, it can be treated and we can help that individual, but you need to find it. And that's the point of this system. So over the past 20 years, we've been able to have a significant impact on that population and helping find incidences of disease and treating it. Any number of publications over the years in JAMA ophthalmology. Recently, I think it was November was the last, had the outcomes of that, just demonstrating the success of the program. The American Academy of Ophthalmology in November awarded the program an achievement award for its activities. So that's been a great program to be part of over the years, driving that. And it takes an image of the back of your eye. It's a camera that takes an image of the back of your eye, the retina. It is forwarded right now to a reading center in Phoenix where a human looks at it. And we are working on various projects now with that to allow AI to look at it. AI, interestingly, in that image analysis for retinopathy is some of the earliest FDA-approved algorithms, going back, 2017, 2018. But those algorithms are very much with cameras that have a very narrow range of view of the back of your eye, a very small percentage. And the cameras that we use have a much wider range, they're called ultra wide, So a lot more surface area of the retina is viewed. So we've had to upscale and develop those new AI algorithms to work on those, and had some work published last year in that. So we're driving forward in that arena, as well as many others. So that was a big, large scale program.
Yeah.
But over the years have developed lots of solutions for big companies, small companies, where it's those anecdotal stories of, the nurse working with your program and like, hey, using, software that you created was able to find the incidence of this and help a patient. And that just makes everything we do, it feels good. When you go to bed at night, it's like, okay, we're making a difference, which is fabulous. Some other projects that we've gotten into were like on more real world evidence projects. So as your solution, you take it to market. It's one thing to do lots of testing and there's clinical trials, but when it hits the real world, all sorts of stuff happens.
Yep.
So how do you capture and track that information over time? And then as that data, even though in particular instances it's fully anonymized, so we don't know who you are, can still use that information to generate evidence to go to large insurance organizations, like, hey, look, this device works, which is, it's not that individual patient. Now we're talking about populations. So it's been a fun journey.
Well, it's interesting. You talked about the image of the back of the retina. I just went to the optometrist last week and had that done. I don't remember why. I think they offered it as an add-on service. I was like, good for you, good upsell. But they did, and that was the first time I had it. And I didn't even have a chance to even ask them, what it was, the purpose of it. So I guess at least I know I don't have diabetes. I think that's probably one positive. But
there you go.
So tell us about some of the trends that you see that are coming. Obviously, AI is a big one, right? We even just touched on it. It's hard to even escape a conversation now to talk about trends without having the conversation about AI. But I also understand that it's going to be significantly impactful to any business in any industry. So maybe if you can talk about some coming trends that you see as they relate to healthcare. That doesn't necessarily have to be AI related, but it's an important part of it too. So touch on that as well.
Yeah, obviously AI, the biggest thing in multiple ways and avenues in healthcare, just making it more effective. It's like, okay, the physician, the doctor knows how to write a letter for prior authorization, but the AI technology can generate that faster. How can we scale? Which is really where AI is going. It's really, how do we scale? How do we be more effective with our resources? But one of those other areas that is definitely trending and coming along is remote monitoring and biometrics, the ability to capture that information. Having been in the industry for 20 years now, I got my start wearing heart rate monitors that had multiple wires string under your shirt to different points in your body to capture that information. Now you wear a ring and or your Apple Watch or something like that, and it captures all sorts of information. And it's just advancing more and more every day, the data that's been captured, the meaningful data that can be captured. But it's also fading into the background. It's becoming more passive. And as our population here in the US and globally gets older, to be able to let, your mother, your father, elder, aunt, uncle stay at home in an environment where they're very comfortable in, they don't want to leave, becomes very powerful. So there are numerous companies out there that now have this passive technology, as sensor under the bed, in the bathroom, on the coffee pot. So I know my father got up this morning. He used the restroom. He went and, turned the coffee on. He went into the living room. So he's following his normal pattern of behavior this morning. Okay, everything's good. Well, fast forward 3 years from now, it's like, okay, man, it's 9 o'clock. He's still not up, hasn't done his coffee. It's like he's not watching TV. So now that you start seeing that disruption of pattern, and it's an intervention point now. Okay, hey, call them up, text them, how you doing? Everything good? That's hugely powerful. So the technology is becoming more and more passive. It ties into AI, because when you have all this data, what do you do with it? How do you make sense of that? AI drives that. But then also, I think something we've been getting into more and more heavily over the last couple of years is this idea of digital therapeutics. So there's probably around 300,000 or so by different counts, digital health apps. So apps, systems that you can download on your desktop. Some entirely just work you yourself and data is not shared. Others that get tied into the healthcare system. But the idea of a digital therapeutic is that it's based on clinical evidence and it's validated that it really works. And then it gets reviewed and approved by the FDA, or if you're in the EU or other countries around the world, the appropriate regulatory bodies,
right,
to be able to say, yes, this works. And the difference is between like vitamins and mineral supplements that you can buy at the drugstore kind of thing. Do they work? Maybe. There's some evidence. Maybe it's a placebo effect. You just feel good, so let me take this. Versus a drug, which has gone through a very extensive, rigorous process to prove that it does work, and it has to be prescribed by a doctor. And that's the difference between the general digital health app and the idea of a digital therapeutic application. The digital therapeutic has gone through that process. It's based on clinical evidence. It's been well tested and validated. The FDA has approved it and said, yes, this has been demonstrated to work. And then it's prescribed by your doctor, and helps. So one, it helps scale healthcare. There's a obesity challenge in the country. There is a mental health epidemic. There are not enough professionals to care for all these people. So how do we scale that? In digital health and digital therapeutics, I think, is the answer to that. So it's a very early industry, the idea of digital therapeutics. There's still reimbursement challenges here in the US of like getting that paid for. But that's another huge differentiator between digital health and digital therapeutics. I, as a patient, okay, I want to download this app. Oh, I have to pay $1 a month. Oh, I don't know if I want to pay $1 a month. It sounds like nothing, but you do see in the real world that people are like, I don't want to pay that $1. But a digital therapeutic gets reimbursed by the insurance industry, and then you can get a higher rate. So as a company developing these and marketing and bringing them, you have a better path to reimbursement. And we've seen various companies in this area try, both approaches, and to see where they go.
Is that why things move slower in terms of things in the healthcare industry, in terms of both from drug advancement to product, advancement, is because of the reimbursement side from the insurance side and how they view things in terms of, hey, is this just going to be an expense, or is it going to be an effective managed care that I can look at and have an ROI down the road, right? Because as you talk about the digital therapeutics, that's the first thing I'm thinking is like, yeah, there's going to be a significant capital expenditure investment in this upfront, but to be able to provide preventative even healthcare at scale, right, is going to be a significant cost savings. But I mean, I want to get your take on it. This is just from a non-healthcare industry type of guy, right?
Yeah, I think healthcare is a slower one because we are dealing with the health of people. So you do have to be more cautious, So you think of AI, it's really easy to use AI in your corporate marketing. Okay, go for it. Mm-hmm. You're not influencing or impacting the health of somebody. AI has this problem where it hallucinates, where it makes stuff up, but it sounds very convincing and very trustworthy kind of thing. So it's hard to differentiate. There's cases even in law where lawyers have been like, oh yeah, here's my argument and here's cases to support it. Well, they didn't do the due diligence to say that, AI just made this case up, and somebody else finds it. Okay, you're not hurting anybody, in a marketing sense, in a legal sense, that has some ramifications. But in healthcare, if you're relying on sort of the current state of where they are and it hallucinates something, adds something, or even doesn't bring up a particular relevant factor, it can have a big impact. So you do have to be a little more cautiously. You do have to play with it. You do have to be aware of it, and we do have to advance the science and the capabilities. But yes, so you have to be a little more cautious with the healthcare. And then you do have, and it's not even just a challenge of reimbursement, which is your sort of original question. Not so much of a challenge of reimbursement, but who's paying for it, who's providing it, who's using it. So when healthcare, you have you as the patient. You might, if you're underage, you might be caring for your child, or an elderly family member. So then there's this caregiver relationship. So how's this working? Your healthcare professional, are you going to one doctor, two doctor, or across multiple institutions? And then you have the insurance company. So okay, the insurance company might be using it. You are paying for it. You are using it, but then you're sharing it with your healthcare provider to try to make a difference. So it has some fairly unique challenges versus other industries. It's not always the person who's paying for it is using it. Everyone has very good intentions and altruism. Insurance company definitely wants to help you improve your care, but the U.S. healthcare system very much is a sick-based care system. You get sick, you get paid, we'll take care of you. That is changing to what's called value-based care, where it's the systems and the people in the systems are incentivized to keep you healthy.
Is that similar to like managed care? I know that there's some managed care type providers, and again, I'm stepping out of into an industry.
Yeah, you probably there are differences. It's not the same thing. You can have value-based care arrangements and in all the different types of insurances, kind of thing. Care is different. But yeah, the goal ultimately is to help improve the health and wellness of people.
Yep. What do you see as the most, when you get involved with a new client or a new prospect that you may be speaking with, what do you see as the most significant value that Astenda and your firm brings to the table, and how do you kind of convey that to, a prospect?
One, I guess just two parts. One, the healthcare medical industry experience. We've been there, done that. We have the experience. We've been doing this for 20 years now. We have a training program in place, so as we onboard new people over time, and even over time, provide that training to our employees, because it's not software development, the healthcare medical industries, they're not static. There's constantly changing. We are what's called ISO 13485 certified, which, interesting, it qualifies us for medical software development. And that ISO certification is really about having a good quality management program in place. So when we embark on a software project, we have a documented SOP. How are we going to do this? It's very template driven. And then tons of checklists. I'm a big fan of checklists. So we are independently audited for compliance with our ISO process internally. Our customers audit us. New customers, we invite you to come in and audit us. Get that level of comfort and satisfaction. We've been doing this for a while. We have the processes in place to do a good job on the project, and so you can have confidence in that. Lots of auditing, which always makes it interesting. But and that's and so it's like the healthcare side and the software side. We can bring those together, and ultimately it's about that end user. So we really strive and try and emphasize the idea of empathy. You're not developing or creating a product for yourself. You are creating it for that end user, and that's alluded to mention the healthcare training that we provide our developers, the QA, everybody that's part of that project, to understand multiple sclerosis. If we're working in multiple sclerosis, what does that look like? What does the journey look like to help everybody in the picture make better decisions?
Yeah, and you mentioned earlier in terms of the nurse at the nurse station and the anecdotal type of feedback, and sometimes that's the most important. Obviously, we're all in business, right? And ROI is the most important driver, but there are things, and you mentioned especially the empathy side of things, and there is those anecdotal examples, right, of the impact that your software and your solutions are helping with clients. So, can you walk us through the path that you were talking about? Obviously, maybe like a new client that comes on board with you. Kind of, you mentioned the checklist and whatnot. Maybe talk a little bit about how the process works in terms of a new client that comes on with Astenda.
Mm-hmm. Yeah, because we are usually creating something new, it starts very much in terms of the design process and working with that customer and their end users to understand what the problem is that they're trying to solve and their particular approach to that. Because you think of diabetes, different institutions have different ways of thinking about it, different algorithms, different methodologies. So we first have to understand where you're coming from, what your approach to solving the challenge is. And then how do we apply that and build a system? And we think of it very much of how do we provide value quickly and reduce risk. So as an example I go to fairly frequently is, I live across town, I need to get to work quickly. And walking takes a long time. Well, okay, I want to create a car. Well, it's going to take you a long time to create that car. So let's create a skateboard. Very easy. Piece of wood, some wheels. So now you're learning. You're getting across town faster. Not as fast as you could. You're getting wet because, it's a skateboard. It's a little wobbly. Okay, let's put a handlebar on it. Okay, now it's much more stable. I'm still not getting there very quickly, but I'm improving. I'm adding value to the picture. Okay, let's add an engine to this now. Now I'm moving really fast. And, then it turns into, becomes motorcycle and the car, and then you put the roof on and, and so you go down that journey of how do we create value as quickly as possible, particularly, in the startup organizations, it's limited funding. How do we get to something that you can put in front of customers, quickly and effectively? And even larger organizations, as we work with the internal customer, they need to prove their idea. Like they had to go to their bosses, potentially to the board, to get the funds to do this particular project. If we come back and say, okay, it'll be 2 years before we have anything, it's like, that doesn't work. It's like, how do we provide something of value really quickly? And the second half of that is reducing risk. Because as you embark on these projects, even the customer, there are things they don't even know about just yet. And we can add a lot of value in terms of that in the healthcare. And I had a conversation a couple of weeks ago. Someone in Europe was coming to the US, and talking about that interoperability. And they're like, oh, we'll just use fire and it'll work. Everybody has fire in the US. I'm like, no, it doesn't quite work like that. So, they had a particular impression, so we can help, we're adding value to that. But they didn't even think about asking those questions just yet. Or it's like, okay, if you're going to the FDA and, the FDA is going to review and approve what you're doing, one of the changes they made last year is, now as part of the documentation you provide, you have to have a cybersecurity plan. How are you addressing cybersecurity? They've always wanted one, for the longest time, but now it's a requirement. Like if you don't submit this in those early stages, we're not even looking at it. Wow. And so if you're not up on what the industry is doing, what the FDA and other global regulatory bodies are asking for, you're not going to, you always want to consider cybersecurity. I don't want to say anybody's not going to, but it's to the level that you have to consider, that you have to document it. And that's where those checklists come in as we talk about those SOPs and the checklists, and you think about application performance. Okay, what does application performance mean? Do you really, talking about, scalability or usability, and you might make the decision on in those early stages, we're not going to address a certain area because we want to develop that skateboard. And okay, we'll consider scalability later, but you've thought about it. And part of having that ISO process and the processes and the checklist is like, okay, we've thought about this. Here's what, why we decided to not address it today, we'll address it in cycle 2, cycle 3 down the road.
Well, I love these conversations because I get to glean some great insights, but more importantly, in this case, I get to steal an analogy that I love. I love your skateboard analogy. I always, on our side, on the sales and marketing side of helping firms, I always tell them we have to, walk before we can run, and sometimes we have to crawl. But I may have to steal a skateboard analogy. I really like that. That drove home the visual, which is 9/10 of what trying to get an idea across. Well, as we wrap up here, what one of the questions I'd like to ask, entrepreneurs, and it can relate to either business or or not, but what do you enjoy doing? What it really revs your engine? And it could be in specific. I know you've touched on some things in terms of why you got into the industry that you're in, which is important. But what do you enjoy most about what you do?
It really focuses on solving problems of the challenge of being presented with new opportunity of like, okay, how are we going to solve X? And that's really just everything I've done, continue to do, and love is solving a problem, in coming up with a solution and the story to convey, okay, here's how we're going to propose and solve this. It's one thing to be like, oh yeah, we're using .NET, on the back end in Azure cloud and this, that, and the other thing. And it's like, a lot of customers are like, what? It's like, how do you create that compelling story, okay, here's what we're going to do. Here's how we're going to approach the problem, solve this. Here's the timelines. That's what drives me every day is just solving problems, taking on new challenges.
I think that's probably the most common thread that I see in successful entrepreneurs is the ones that embrace and love the problem solving side of it, because there is never a lack of problems to solve. Those will never go away. There's always challenges tomorrow, and the ones that embrace it and love the challenge of solving those challenges are usually the ones that are most successful. So I concur with that one. So what's a good way for people to find you? As we wrap up here, I would bet you're on LinkedIn, and I can put all the links there. Maybe you can tell people how they can get in touch with you or Astenda in terms of maybe even taking a next step and having a conversation about whether or not you might be able to help them out.
Yeah, absolutely. Thank you. Our website, first and foremost, Astenda.com, ESTNDA.com. Have a big, heavy presence on LinkedIn. Follow us there because we're trying to put out lots of good content, value into the world around the AI, the digital therapeutics, software development. We're doing some webinars coming up. We'll post one probably later this week around AI, using AI in product development. And then just how to do one following that'll be around software estimation. There's lots of challenges in estimating how long it takes software to estimate it. Lots of human-based biases. So if you're aware of them, then you can address them and address them to make a better estimate, have a better idea of how long it will take to create the software. So really trying to build our presence out there in that area. My personal LinkedIn profile is always good. And then we attend various conferences. So we'll be at CES in early January, Vive conference, Health 2.0 conference. We'll be at a bunch of those. So look for us there.
Great. Well, that we will, and I appreciate it as always your time. I've enjoyed our conversation. It's one that's slightly outside of the typical scope of industries that I'm I'm trying to get more comfortable in terms of healthcare. It has its challenges, obviously, that are very, very unique. And having been around for 20 years, I'm sure Astenda has a leg up on folks in terms of being able to help them. So I greatly appreciate your time, RJ, and look forward to hopefully having you back in. We can do this again.
Yeah, look forward to it. This is a great conversation. Thank you.
Thank you.